Hello friends. Today I am going to talk about a very latest development in the research of eye diseases, and today is 21st March 2022, and I am talking about a news that has come only 2 days back, and that is a research paper which was published by University of California, Berkeley, and it has very interesting news for us. Now, we've been using some medicine for alcohol de-addiction for years together. Say for last 3-4 decades, we've been using this drug to de-addict people from alcoholism. Now, it is found that this drug, if given to patients with progressive retinal diseases like retinitis pigmentosa and age-related macular degeneration, diseases for which we had no treatment till date. So this medicine is very helpful in those cases. So I'll be telling you name of this medicine later on, but first I would like to explain what kind of experiment they have done in mice, and they have found that in mice this drug has been very helpful and potent to cure their retinal degenerations. So this was done in cases of mice where they trained mice to identify certain patterns on the computer screen. It was seen that after the retinal degeneration, those mice who were given this particular medicine, they were able to recognize those patterns on the computer screen even after that degeneration because they were on medication, while the placebo group, the other group of mice which were not given this particular medicine, they were not able to recognize those patterns on the computer screen. So friends, this medicine which may become a miracle for eye diseases which had no answer till now is called, in general it's called anti-abuse. So medicine against abuse of certain toxic substances, and the salt name is DISULFIRAM. This medicine, when given to people who are addicted to alcohol, and if it is given to them before consuming alcohol, whether with their consent and with their knowledge, or sometimes family members are asked to give this medicines mixed with their food so that they are not aware that they are taking this medicines. So once they take this medicine and after that they consume alcohol, there is a very severe reaction in these people where they get very severe nausea, vomiting, giddiness, and lethargy, sleepiness, and all those symptoms which are very bad to experience. So in this case, when patient sees that every time he or she takes alcohol, there is a severe reaction in his body. So this helps them to stay away from alcohol. Now the same medicine was seen to be effective in reducing the retinoic acid content. And now see, this retinoic acid is the component which are rods and cones, the photoreceptor cells in our retina. They release when they die. So there is accumulation of retinoic acid in the retina, and this retinoic acid creates a buzzing effect in the neuron cells of the retina. So this is, you can understand this situation that if there is a lot of noise in a particular environment, then we cannot understand the talk we are doing with the other person. So when there is accumulation of retinoic acid, it makes those ganglion cells which connect eye to the brain, they make them busy. So there is a lot of electric traffic going on between eye and brain. So this causes problem with the normal signals or normal things we want to see. So it's like there's a lot of congestion and the main thing we want to see is not visible to us because a lot of activity is happening in the ganglion cells. So friends, once this disulfiram is given to these individuals, then it will reduce the retinoic acid, and then it will clear path for the vision of retinitis pigmentosa patients and patients with age-related macular degeneration, and they'll be able to perceive objects in front of them better. So friends, this new discovery of medicine, in fact, it's not a new discovery, it's an old medicine which can be used for a new disease now, is very, very exciting, and we are very hopeful that in future diseases like retinitis pigmentosa and age-related macular degeneration and a number of other retinal diseases will be able to control better and treat to some extent. So there is hope for these patients for whom we do not have any specific therapy at present. So future is hopeful for these patients, and we hope that soon we will have the trials on human beings, and then the drug will be available for human consumption also. As it is, this is an FDA approved medicine, and the side effects other than after consuming alcohol are very minimal. So the drug shouldn't take much long to come to for retina patients. So we hope that soon we'll have this medicine for untreatable diseases like retinitis pigmentosa and age-related macular degeneration. Well friends, thank you for listening to this latest development. We will be coming up with more such information in future.